Dear colleagues, good morning from Athens, Greece. First of all, I would like to thank Dr. Chabra for giving me the opportunity to present in this important Congress. And I would quickly go now to share my screen to discuss the BIA or DXA, which is a better tool for assessment of body composition in persons with SCI. So, regarding body composition measurements, we are aware that we have, of course, the direct methods, the cadaver analysis, which is not our case today. However, we can use also indirect methods and the double indirect methods. And the indirect methods such as DXA, we have one assumption we rely on versus the double indirect methods such as BIA. We have at least two assumptions we rely on. And we have to realize that the more assumption, the less the accuracy. Regarding bioelectrical impedance analysis, this is a method to assess body composition, the total body water, fat-free mass, fat mass. It's not too advanced method. We can measure resistance and reactance as we will see later on. How to apply the BIA? With put the patient subject in the line position, the electrodes on both hand and feet, and a measurement takes place less than 15 to 20 seconds, and the subject does not feel anything of that. How does it work? In BIA, the bioelectric impedance of an alternating current passing through the body is measured. And this method is based on the principle that body's resistance to alternating current is inversely proportional to the body water volumes. And with BIA, you first measure body's resistance and then translate that resistance into body composition measures. So, as you can see here in this graphic, at the lower frequency, the current does not pass through the cells, but at the higher frequency, passes through the cells and then gives the information on body composition. Estimates fat-free mass from body electrical properties, the resistance and reactance vectors, which are used in predictive equations, which consider sex, age, height, and weight. And this is a two-compartment model. It measures fat-free mass and fat mass. From the resistance, you can calculate fat and fat-free mass. And there are many equations published previously by Kyle et al. 2004. You can see some of them. I don't want to analyze all the equations because we do not have the time, but this publication shows that 5 of bioelectrical impedance analysis equation against dual X-ray absorptiometry and how they estimate appendicular skeletal muscle mass. As you can see here, we have BIA instruments with single frequency and multi-frequency. I will discuss this later on. How to conduct this measurement? In patients with a pacemaker, preferably not. We need to have an empty bladder because it measures water, to measure height, to measure weight, to remove all jewelry empty the pockets, no metal implants in the body, no heavy physical activity before measurement, rest 5 to 10 minutes before, and no need to be fasted for the patient. It has no influence. BIA has some pros and cons. It's a quick and easy performed, it's not invasively, high reproducible, reduce results are direct available, and we have raw data. But it has cons, it requires proper standardization, is dependent on regression equation of model assumption, lack of calibration with the device in general has good accuracy of body composition result at group level, but large differences at individual level. And the accuracy of body composition of fat-free mass at individual level may be questionable. Coming now to DXA, some basic principles. It's more advanced method to measure body composition, especially muscle mass. It measures also not only body composition, but also, as we know, bone density. This is a 3-compartment model here with bone and soft tissue mass, which is measuring fat mass and lean mass, including bone-free and fat-free mass. As I said before, it's an indirect method of body composition assessment, and body tissues differ in absorption of radiation. DXA technology has subsequently been adapted for the assessment of whole body composition and offers estimation rapidly, non-invasively, and with minimal radiation exposure. DXA is not dependent on other measurements. An agreement between weight calculated by DXA and actual weight is excellent. DXA soft tissue composition can only be determined from whole body scans, as we know. These whole body scans can then be analyzed to measure the body composition in defined regions of these scans, for example, in the arms, legs, and trunk. And this is of great interest because the distribution of bone mineral and fat is not uniform throughout the body. Here you can see a whole body scan picture. As you see on the left is a picture from a paraplegic person compared to a picture of an able-bodied person. And with DXA, we can have reports and we can calculate some important indices, for example, skeletal muscle index or sarcopenia or fat muscle index for sarcopenic obesity, and so on. You can see on the left and right, respectively, pictures from a Norland device and lunar prodigy device, respectively. Coming now to spinal cord injury, Kochina and Hayward fat-free mass predictive equation is the only BIA predictive equation validated for SCI individuals compared to fat-free mass obtained using DXA. And you can see this equation is here with some variables here, height, resistance, weight, age, and gender. So the inability of BIA to accurately predict percentage in the sample of SCI may be related to several factors. The inclusion of weight in the BIA-predictive equation may reduce its accuracy in determining change in lean body mass. In the BIA method, it is almost impossible to measure accurately height in subjects with SCI because of their muscle contractures. And it can be an over and underestimation of height. For example, 2.5 centimeters leads to a small error in the estimation of percentage budget below body fat, percentage of body fat below 5%. Another major problem is body asymmetry, which renders the assumption of a symmetrical configuration of the human body invalid in this case. So we have here a study in cervical spinal cord injury, used some equations in order to see which has a better validation and accuracy, use the equation from Kochina and Hayward, and also from Buchholz in paraplegics. Good equations. However, the use of a non-specific equation can lead to misinterpretation in fat-free mass values in male cervical SCI individuals. So predictive equation for this group need to be developed according to the authors. In high spinal cord injury, the lack of muscle contractions can cause edema, mainly in the lower limbs, and versus DXA, which in the literature it's stated that it is not affected by factors such as hydration levels. This statement could be wrong because DXA assumes that the hydration of fat-free tissue remains constant at 73%. However, hydration can vary from 67% to 85%. And if a subject contains more than the average amount of water, DXA will overestimate the fat content. Coming now to this systematical review, the president of the Congress is also included in this publication, and BIA has been used during rehabilitation of SCI, and it has helped measure body composition. And BIA has recognized validation for the classification of obesity in acute SCI. 13 studies have demonstrated that BIA's using SCI has been confirmed to be extremely specific, but barely susceptible to the disparity between obese and non-obese people with paraplegia. And accordingly, the level of injuries in the spinal cord has shown a difference in the measurements using the BIA tool. So this difference should be considered when measuring SCI patients. Coming now to this publication, to this technology, the bioimpedance spectroscopy. What is this? It's a derivative of BIA. Bioelectrical impedance methods are often classified by the number of frequency used for analysis, with BIA often referring to single frequency devices, whereas multi-frequency devices are referred to as a bioelectrical spectroscopy, as it uses a spectra of frequencies. So the conclusion of this publication was that BIS can be used to accurately predict total body fat-free mass, segmental lean tissue mass, and appendicular lean mass in individuals with acute SCI. The accuracy of skeletal muscle estimates from DXA may be compromised in disease states and conditions associated with extreme muscle atrophy, such as spinal cord injury, and a lower ratio of muscle to adipose tissue-free mass indicates a lower proportion of muscle in the fat-free soft tissue mass. This is important because there is a dramatic reduction in the cross-sectional area of skeletal muscle in the thighs after SCI. If there is indeed a lower proportion of skeletal muscle in the thighs relative to fat-free soft tissue mass in individuals with SCI, muscle mass would be overestimated by prediction models that assume that muscle represents all of a certain proportion of FFST. Coming now to the opinion of the stakeholder with SCI, they consider the measurement burden of DXA acceptable if it was reliable, valid, and would do not harm. And the practitioners also indicated their confidence that DXA is a reliable and valid assessment tool with acceptable measurement burden for measuring body composition. However, they consider cost and accessibility major barriers, particularly for sport performance settings. This review found that whole body DXA is the only tool with both test-retest reliability and convergent validity evidence to support its use in SCI practice, given that any measurement tool should be both reliable and valid in order to recommend its use in research or clinical practice. To conclude, obtaining reliable measures in persons with SCI may be challenging due to physical, for example, contractions, spasticity, hardware in the body, urine reservoirs, obesity, and logistical, transferring positional barriers, introducing error of measurement. While BIA is a convenient and affordable method for measuring body composition, it is not as accurate as DXA. DXA is the clinical gold standard for measuring body composition and provides a detailed and precise analysis of body fat, muscle mass, and large bone density. Thank you for inviting me, and thank you for your attention.